So mental health conditions are also conditions that people experience. And really, we need to treat them with care and love also.
99 FM, it is now time for MYD Heart, and aiming to provide integrated, affordable, accessible and quality health and social welfare services that are responsive to the needs of the Namibian population. The Ministry of Health and Social Services recently inaugurated a mental health board for the period of 2022 to 2025. The Minister of Health and Social Services, Dr. Kalumbi Shangula, recently called for increased investments in the provision and promotion of mental health programs and services in the country. Now, joining us on MYD Heart this afternoon is the Honourable Deputy Minister of Health and Social Services, Dr. Esther Utjiua Muinjangue, to tell us more about it. Honourable, welcome to 99 FM.
So I'm happy to be here, yes.
Thank you so much. Let's dive straight into it, shall we? Can you tell us more about the services offered by the ministry in terms of mental health?
Right, thank you very much. As you put it, yes, mental health is it has been always on the periphery. It's not really one of those topics that people are easily talking about or discussing openly. And of course, as a ministry, as you rightly said, that we are there to provide curative as well as promotive services that respond to the needs of the Namibians. We also are doing a lot in the field or area of mental health. Now, there are a lot of programs that are happening in the ministry. First of all, before I say what exactly do we do, it's important to emphasize that we have a challenge of or a shortage of specialized nurses, especially in psychiatric nursing. So in that regard, as a ministry, we enhance the human capital development on mental health. What do? We sensitize all the regions because we want all the regions to send nurses that can specialize in postgraduate mental health diploma courses at the University of Namibia. I think currently we have 4 enrolled nurses, but there are 9 who have completed the training. So we also conduct in-service trainings to district hospitals as well as other public sectors, for example, correctional services on the management of mental health conditions. And it is also important to have a well-coordinated, effective and efficient mental health services delivery, because as we know, mental health is cross-cutting, and it's not something that can be delivered or controlled by the Ministry of Health and Social Services alone. You need to have a multi-sectoral approach. And therefore, with the multi-sectoral services that are available, we have psychologists, we also have psychological counselors, so they provide that necessary psychological assessment as well as intervention, the psychotherapy. But then we also have our social workers. The social workers are the ones who are the link between the family, community, and the patients. They provide counseling, they provide psychosocial support as well. And of course, psychiatrists, because you cannot render mental health services without psychiatrists, without psychiatric nurses. They attend to the referrals for possible interventions to the people with who are displaying mental signs, and also occupational therapists. And so you can see, as I mentioned, all these different areas is because of that multi-sectoral approach that is needed to render the best services to the patients. Yeah.
Thank you so much, Honourable, on elaborating on the services. Honourable, what programs are currently in place in the provision and promotion of mental health in the country? And would you say there's an urgent need to address mental health challenges in the public sector?
Yes, there is a need, not only in the public health sectors, but also at all the levels, at individual, family levels, community levels, because this is a topic that people don't discuss. Why? Because there is discrimination attached to it. So you hear people still talking about Malcolm, and I can recall just a few days ago, someone said, I'm so tired of taking my sister every time to the Malcolm. And I said, but we don't have a Malcolm. Yeah, that place where people who are not well. I said, okay, you mean the mental health center. So we need to create more awareness and also public education for people to understand that mental health does not define the person, does not say this person is like this because of his or her condition. So we always want people to understand that mental health does not define the person. It's just like when you walk in the rain, you feel the rain, but you don't become the rain. It's something that you experience. So mental health conditions are also conditions that people experience. And really, we need to treat them with care and love also, and not discriminate against them and give them names. But we do that because the community does not understand also. So that is why it is so important to create that awareness for communities to understand. Now, mental health does not only, it's not in isolation. That's why we integrate it also with other programs. Like, for example, the KSTP, Commerce Suicide Prevention Task Force. It's on suicide prevention, but you cannot divorce suicide prevention or suicidal thoughts from mental health. So all those platforms are platforms that they are using to create awareness. So they go to schools, they go to communities. We also celebrate or commemorate, mental health days in order to create awareness. And also, very important, to collaborate with various stakeholders as well.
Thank you so much, Honourable. Honourable, what more can be done to not only improve the mental health services in the country, but, as you say, the negative connotations attached to mental health and the conversation? What more can be done to improve this as a country?
Okay. I should say, like recently, we also launched our mental health board. Now, the board members are consisting of different, people from different disciplines, like psychiatrists, social workers, but most important, we also have a community member representing communities, because we want really to go into communities. And even if you look at the mental health bill that I hope that early next year we will table it in Parliament, it's also putting a lot of emphasis in the involvement of communities, because we need to bring the communities closer, because as much as we try to do programs and awareness from our side as a ministry, we still need the involvement of community members, because we don't want to keep them also for the rest of their lives in the institutions. So they need to be reintegrated in the communities, and hence the importance of communities also to understand what mental health is.
Thank you so much, Honourable. Just my next question would be just any advice that you might have for the general public and the listeners out there right now in regards to the topic of mental health.
Yeah, to the public out there, I would urge the public to be sensitive and also to be considerate when we engage people with mental health conditions, and also most important to be aware of what are the signs, because sometimes you hear someone coming to your office saying that we have a family member, this person is hearing voices, he's seeing things and so on. That is a condition, with a name, schizophrenia, but for them as a community, they don't understand. And what do? Most of the time, we link this or associate this to witchcraft. And instead of looking for professional clinical assistance, we prefer to go to a traditional healer because we don't have an understanding. So I want to urge the public that it's a condition that can be controlled, that can be managed, and therefore we should not feel ashamed to talk and discuss about these issues. But most important, we should familiarize ourselves with what are the signs. Because you find sometimes you hear people saying that, after the death of the husband or the child, this person has become withdrawn. This person is isolating himself or herself from the rest of the family members. So we are seeing a change in the behavior of that person. But what are we doing about it? We don't do anything about it. So we want people to understand that if you have a mental condition, it does not define who you are. That's a condition that can be controlled with medication because you are not becoming the rain, even if you feel the rain. Yeah.
Honourable, thank you for the wise words there. And just for the people and those in need, maybe listening right now, those that are in need of mental health services provided by the ministry, how can they make use of such services, and who can they contact, or which centers and offices should they make use of?
We have the mental health unit at the Windhoek Central Hospital, where they can also reach out. The contact number there is 061 203 3321. We have Lifeline Childline, where counselors are available, and they have toll-free numbers, which are 106 and 116 that people can also call anytime. Then we have organizations such as Philippi Trust that also provide counseling and psychosocial support. But we see in cases, but there are also other private facilities. But it happens sometimes that a family member is sitting with someone who is suicidal, and then they don't know what to do at that particular moment. If they call the city police, they can also be of assistance, because they will go out to the house, and then with the assistance of the city police, this person can be taken to the nearest health facility, and then can get attention, and depending on what the condition is, they can decide whether this person need to be admitted at the mental health facility or not.
Honourable, thank you so much just for taking the time out to have this conversation on behalf of the ministry, and just and shed light to the public on a conversation that needs to continuously be had in our lovely country. Once again, thank you so much for taking the time.
Thank you for having me, and it's always a pleasure, because we are there to serve the Namibian nation.
And that is the lovely Honourable Deputy Minister of Health and Social Services, Dr. Esther Utjiua Muinjangue, to shed more on mental health. It's MYD Heart, where we open up our hearts to conversations that need to be had. Skrypt in the afternoon on 99 FM.
MYD Heart was proudly brought to you by NHP. NHP, we are about you.